Hey everybody, welcome to Facial Plastics Friday. It's Dr. Brace here, and today we'll finish our series on eyelid surgery, talking about the double eyelid surgery or Asian eyelid surgery. So quickly before I jump into that, let's talk about some eyelid anatomy. So I'm gonna use my own eyelids and a little Q-tip here, but this is, my eyebrow, the brow. This is the infrabrow skin. This is my upper eyelid skin, and this crease is my supratarsal crease, and this is my tarsal platform or tarsal plate. So when we talk about a double eyelid, it's the separation of the eyelid from the tarsal platform to the upper eyelid that makes it look like two distinct areas of the eyelid. And so some people say up to half of Asian people from Korea, Mongolia, Japan, those nations will have a mono eyelid, meaning that this crease is absent. And this is just a genetic familial feature. There's nothing wrong with the eyes. They function perfectly fine. But sometimes for cosmetic reasons, for familial reasons to look more like mom or dad, surgery is sought out in order to recreate or to create this fold if it doesn't exist. And this is really just an understanding of the anatomy to make the fold appear in an eyelid where it's not there. Essentially, in my eyelid, because I have a double eyelid, what's happening is the muscle that's in my eyelid below my orbicularis muscle, which lets me squint, the muscle that's my levator muscle that lets me open my eyelid, has little fibers that insert onto the tarsal plate. It's a little cartilage plate that makes this platform here, but also fibers that insert into my skin, and those fibers pull my skin in and make this fold. So in somebody with a monolid, those fibers only insert into the tarsal plate, and therefore there is no fold in the upper eyelid. So to recreate the fold, or to create the fold if it doesn't exist, what we do is we make an incision where we want the fold to be. We then remove some of the soft tissues, the orbicularis muscle and some of the fat and the orbital septum, until we get to that muscle, that levator muscle. And then we use sutures to sew that muscle to the skin. And so it's a very straightforward procedure, but it's a very powerful procedure because if somebody wants to create the appearance of a double lid, it can be done under local anesthetic, it can be done safely, and it can be done pretty reliably to create that double lid look. Now there are nuances with the surgery. Some people want a fold that goes all the way across, some people want a lateral flare, some people want it to not go all the way into the corner. And so Asian eyelids have different flavors and different looks, and that can be figured out in a discussion, in a consult, exactly what the eye is desired to look like. And so I'm going to show you an example here. This page, this person is on our Instagram page a couple months ago, but you can see the upper eyelids here have basically a mono lid, and in the after photo, 3 months after surgery, after the swelling has come down, you can see the recreation of the double eyelid here with the separation of the tarsal platform or the tarsal plate from the upper eyelid. And so that is what's called an Asian eyelid surgery or a double lid surgery, and it's a pretty straightforward procedure. So if you have any questions about eyelid surgery at all from any of the topics we've covered over the last 4 weeks, please send us some messages. We love getting those messages, and I check my phone pretty frequently into Saturday until the story disappears to answer those for you guys. If not, everybody have a great weekend, and we'll see you next week. Bye-bye.